All right. Okay, I'm going to show you how to mix up your HCG as you're starting treatment with us. So you should have gotten a package that came with bacteriostatic water. They will send this anywhere from a 10 ml to a 30 ml vial. So just kind of look on the side of there so you can see how much you got. Sometimes there's extra. You also had another vial of HCG. You'll notice a powdery substance in the bottom there. That is actually your HCG. And then you got your mixing needle and syringe. These are sometimes connected. In this case, they are separate. So we're going to show you how to attach those. So your first step is you're going to attach these two things. You're going to take your needle and just turn that and twist until it locks tight on the top of your syringe. Take that plastic cover off that and you're ready to go as far as your needle. When you are mixing with the bacteriostatic water, how much of this you're going to use depends on how many IUs or international units you have in your vial of HCG that you're using. Dosage on these vials is going to come in either 5,000, 10,000, or 11,000 IU. If you have a 5,000 ml vial, or I'm sorry, a 5,000 IU vial, you're going to mix that with 5 mils of water. If you have a 10,000 or an 11,000 IU vial, you're going to mix that with 10 mils of the water. So we're going to go ahead and draw this up as 10 mils because we have an 11,000 IU vial here. So you're just going to go ahead and inject that bigger needle into the bottom of the water, and then you're going to draw that up until that registers either at 5 or 10 depending on what size you're using. So on the 10, we're going to draw that all the way up to the bottom here, and we want the top ring of that black plunger to come right down to meet the line that we're drawing this up towards. So right there for our 10 mils, and then just go ahead and pull that out. Now we're going to inject that into our vial here. We do want to make sure that we have as few air bubbles in this as possible before we inject, so we have our dosage right. Sometimes you'll get an air bubble on top if you continue to pull after you pull that out of the vial. In this case, we push that out and we're still at 10 mils, so we're okay. Now when you put that into the vial here, one of two things are going to happen. Either it's going to pull the water all the way in automatically, you won't have to do anything, or there's already going to be air pressure in there and you'll feel some resistance as you start to push the plunger down. If you feel resistance, you're going to want to stop 2 or 3 times while you're injecting that 10 mils to let the air push back and fill up into the back half of the syringe here. That'll keep it from popping or spitting medicine out of this vial when you're done injecting. If it's already got water in it, or if it's already had the air removed, like I think this one has, it's just going to pull your water right into the vial. Nope, we're going to have to push this one in. So just push a little bit in and then let it push back, and you'll get an air bubble at the top, but we're going to keep pushing that water from the bottom down into there. And we're going to make sure we get all that water in there. Heard a little bit of spitting there right at the end, but much less than it could have been, and we didn't waste any medicine. Okay, now for our HCG diet, we are going to show you how to inject. You should have gotten some alcohol pads here. You're going to use that to clean the skin right before you inject. And you have these insulin syringes. These are one-use syringes that you can use to inject into the fat around the belly. For our diet, we're going to draw this up to 25 units right there on the side. So we're just going to pull that back. Let that water fill up in the syringe there behind the needle, and make sure you don't have too many air bubbles in there because that'll affect your dosage. Again, we want to get the top line of that black plunger right up to the line where we're trying to draw that up to, and then go ahead and remove that. Store your HCG in the refrigerator after you've mixed it. It's stable at room temperature until you've mixed the water and the powder together. After you've mixed it, you want to store this in the fridge. When you're going to inject this, you're going to start by cleaning with the alcohol pad, but then you're going to squeeze some of the skin around the belly, just to the side of the belly button. So you're going to squeeze like this, and you should have a small roll of fat there between the finger. When you inject, you're going to put this at a 45-degree angle, And because this is a smaller needle, you can bury that all the way up into the hub. Shouldn't hurt, and you won't go any deeper than the subcutaneous tissue, which is the fat that we're trying to get this into. So again, pull that up and then inject at 45. Once you've buried that needle, you can start to depress the plunger here. You're going to continue to hold that skin until you inject all of the medicine. Once you have done that, you can let go of the skin, and then you will remove the needle from the skin. If you mess up that order just a little bit, it's not as big a deal, but you will waste the least amount of medicine by doing it in that order. When you're done with this, you're going to dispose of this in a red sharps container, and you are done for the day.